You've likely been hearing a lot about a second wave.
A second wave of the coronavirus outbreak in the fall.
The second wave of COVID-19.
Will there be a second wave?
We are going to see a new wave.
Countries, including Canada, are starting to open up their economies. By lifting restrictions, there's a risk that coronavirus cases can spike. So we look to history for answers. In this case, it's the Spanish flu, the largest pandemic in modern history. The 1918 influenza pandemic had 3 distinct waves of infection, with the second being extremely deadly. The first wave happened in the spring of 1918, with the second wave coming in the fall. As you can see, the second wave was responsible for most of the deaths. Then came the third wave, which happened in the spring of the following year. It is estimated that a total of 50 million people died worldwide from the Spanish flu. The pandemic ended in the winter of 1920. Although looking to the past may give us some hints on how the coronavirus pandemic may unfold, experts I spoke to say these comparisons should come with a grain of salt, since so much has changed since then. When the world was hit with the Spanish flu, the First World War was coming to an end. The second wave of infections came when troops were going back home. On top of that, healthcare systems were not as developed as today, modes of communication differed, and physical distancing practices weren't as stringent. So the circumstances around the COVID-19 outbreak aren't the same, but we still face a set of challenges that could lead to a second wave. First, we know that a vaccine is not available yet. Restrictions are being lifted, and immunity is still not clear. Knowing this, we have to understand as a population that new outbreaks are probable when physical distancing measures aren't followed.
But we know that the population in Canada is still mostly susceptible to this virus, so that there is continuously still the chance that it could reignite into clusters that then become outbreaks.
Another important part of the calculation, mass testing and contact tracing. By having these measures in place, it can significantly reduce the chance of a second wave.
It's really important to remember this is an asymptomatic pandemic. People can feel absolutely fine and be very contagious at the same time. So that's why it's even more important to do sentinel testing.
In South Korea, for example, which has been praised for its rapid testing and containing of the virus, recently saw a cluster of new outbreaks in its capital, sparking fear of a second wave. It called for renewed tracking and aggressive testing measures shortly after the country eased up on restrictions. One thing to note though, it's not a realistic option to test absolutely everyone, since there are only so many testing kits and resources available. So Furness says it would be best to find a happy middle by testing the most at-risk populations. By doing that, and being on top of new cases, public health can better trace who was exposed. That's where contact tracing comes in.
You try and answer 2 questions. Where did they get it from? Who is out there spreading it that created this case? And given that we have this new case, what contacts has this person had with other people who might then get sick?
The goal of this is to quickly identify who's been exposed so they can go into self-isolation. By self-isolating, we then stop the spread and reduce the risk of a second wave. So while Canada and countries around the world are starting to lift restrictions, mass testing and contact tracing will be key, at least until a vaccine is available. Thanks for watching. To stay up to date on the latest breaking national and international news, be sure to subscribe to our channel, where we also dig into big issues around the world in our weekly series, Global News Explains.